Good morning, everyone. Bonjour à tous. Je suis très heureux.
I am pleased to be here with Minister Anand, Dr. Njoo, and Major-General Fortin.
Important news to share on vaccines. From day one of this crisis, our government's top priority has been protecting people around the country. Since March, we've procured billions of pieces of PPE and secured millions of rapid tests, which we have sent to the provinces and territories to get to the front lines. We've also provided tens of billions of dollars to the provinces and territories for healthcare, essential workers, and school safety. We're using every tool in the toolbox to keep people safe and get Canada through the storm. It's been a difficult year, and we're not out of the crisis yet. But now, vaccines are coming. Notre objectif est de fournir.
Our goal is to have a safe and effective vaccine that we can deliver to Canadians as soon as possible. During the latest meeting with the premiers, Minister Leblanc spoke to them about the importance of working together, of all of us working together, provinces, territories, the federal government, and Indigenous communities for the deployment of the vaccine. A week ago, we also announced the implementation of a National Centre of Operations that will be run by the Public Health Administration, supported by the Armed Forces. General Fortin is responsible for coordination and logistics, and I know that he knows what to do in need.
Largest immunization in the history of our country. This is no small task, which is why we have a clear plan. Our government, through the National Operations Centre, has been working with the provinces and territories to ensure that we're ready to roll out vaccine doses as soon as they're approved and delivered. On procurement of these vaccines, Minister Anand and her team have been working tirelessly to secure the most diverse portfolio of vaccines in the world, and today we see those efforts paying off. Canada has secured an agreement with Pfizer to begin early delivery of doses of their vaccine candidate. We are now contracted to receive up to 249,000 of our initial doses of Pfizer-BioNTech's COVID-19 vaccine in the month of December. Pending Health Canada approval, the first shipment of doses is tracking for delivery next week. Shipments will continue to arrive into 2021 with millions of doses on the way. This will move us forward on our whole timeline of vaccine rollout and is a positive development in getting Canadians protected as soon as possible. Pfizer, the Public Health Agency, and the provinces are working together to finalize preparations at the first 14 vaccination sites this week. I want to assure Canadians that any vaccine approved in Canada will be safe and effective. The regulatory process is ongoing and experts are working around the clock. They will uphold Canada's globally recognized gold standard for medical approvals. Le Canada a conclu une entente avec Pfizer.
Canada secured an agreement with Pfizer to receive doses of their vaccine candidate sooner. We will be receiving up to 249,000 doses by Pfizer-BioNTech in December. This is pending Health Canada approval, but we could receive the first doses next week, which with millions of doses ready, and we will be receiving them in 2021. This is an important and positive development in our vaccine rollout plan. This will also allow us to protect Canadians as quickly as possible. The Public Health Agency, provinces, and Pfizer will be working together this week in order to finalize preparations for the 14 vaccination sites. I would like to take this time to reaffirm that you can be certain that any vaccine that is approved in Canada will be safe and effective. The regulatory process is ongoing, and the experts are working hard. Canada is known for its high standards for medical approval, and This vaccine will be no exception. We also have agreements with 6 other vaccine candidates. So, we have the largest portfolio of vaccines in the world. On top of Pfizer-BioNTech, we also have Moderna, AstraZeneca Oxford, and Janssen that have sent their vaccine candidates to Health Canada. We are doing all that we can to ensure that Canadians will have access to a safe and effective vaccine as quickly as possible, as soon as the doses are ready.
Are on the horizon. Remember, they cannot protect you if you get COVID-19 now. I know this winter will be hard, especially with the holidays fast approaching. But we're coming into the final miles of this crisis. So let's all buckle down and do what's necessary to keep ourselves and others safe. Over the last few days, we've seen new records of COVID-19 cases in a number of provinces. Hospitalizations are rising, families are losing people, and our most vulnerable are at risk. Just because we're getting closer to vaccines doesn't mean we can afford to become complacent. And on the other hand, just because the numbers are spiking doesn't mean we should give up in despair. Let's keep working together. And let's remember that together we will get through this. Parce qu'on se prépare à l'arrivée de vaccins.
We are waiting for a safe and effective vaccine. And in the meantime, it is important to keep up our other efforts. What we need to do is clear. Wear a mask, wash your hands, maintain physical distancing, and download and use the COVID Alert app. Avoid gatherings, and do not put your health or other people's health at risk. And together we will make it through this.
I also want to recognize that 50 years ago today, the report by the Royal Commission on the Status of Women in Canada was tabled in Parliament. When it was published, this report was a landmark document helping drive progress on gender equality. 50 years later, we've come a long way. But with this pandemic impacting women disproportionately, we're reminded that there is still much further to go. One of the most significant recommendations of the Royal Commission was to take action on childcare. Today, we are committed to moving forward with a universal childcare system. Our government will continue to take the steps needed to build and rebuild a fairer, more equal Canada for everyone. Today, I also want to recognize the news that National Chief Perry Bellegarde will not be running for another term. Perry has been a tireless leader and advocate for First Nations, and I know I am joined by people across the country in recognizing and celebrating his years of devoted service to First Nations communities. We lift you up, Perry. We will continue to work with the National Chief to advance the priorities identified by First Nations, including keeping First Nations communities safe from this pandemic. Finalement, j'aimerais conclure.
And finally, I would like to conclude by congratulating Michael Sabia, who will be the new Deputy Minister of Finance. He worked very well at the Canada Infrastructure Bank, and I'm sure that his work will be useful to us as we rebuild a strong and resilient economy. Paul Rochon has been the Deputy Minister of Finance since 2014, and I would like to thank him for all his years of devotion and exceptional work throughout the pandemic. Thank you, everyone.
Anita.
Thank you, Prime Minister, and thank you also for mentioning the important report on the Royal Commission on the Status of Women, such an important milestone for us to remember. Depuis le début de cette pandémie,
since the beginning of this pandemic, the Department of Procurement and Public Services and I have worked tirelessly to ensure that frontline healthcare workers have the necessary PPE, which they need to do their work. Provinces and territories have access to the rapid tests that they need. We've We want Canadians to have access to safe and efficient vaccines.
Canada has worked tirelessly to ensure that Canadian frontline healthcare workers have the vital PPE necessary to do their jobs. The provinces and territories have access to the testing supplies and rapid test kits that they require, and that all Canadians have access to safe and effective vaccines. We have ensured that Canadians have access to the supplies and vaccines needed in a hyper-competitive global marketplace marked by uncertainty, volatile supply chains, and shortages of raw materials. It is because of this reality that we continue to pursue an aggressive procurement strategy with a diverse portfolio of suppliers, whether in the area of PPE or vaccines. On PPE, we have procured more than 2.5 billion items of PPE. We've received more than 1.25 billion articles of PPE to date. To be clear, this inventory includes Canada's complete order of more than 20 million litres of hand sanitizer, 90% of the face shields and gowns that we have ordered, and more than 84 million N95 respirators. Millions of made in Canada N95s will continue to arrive for at least a decade. Our unrelenting approach to procurement is also why deliveries of vaccine doses will begin this year instead of next, pending regulatory approval. With up to 249,000 Pfizer doses coming this month, we are ensuring that Canada is well placed to undertake the largest mass vaccination operation in Canadian history. Thank you also to General Fortin for joining our team in this regard. Throughout 2021, I want to assure you that millions and millions of vaccines will continually flow into this country once they are approved by Health Canada. That has been our procurement strategy from day one. L'annonce d'aujourd'hui nous donne...
Today's announcement gives us the assurance that there is a light at the end of the tunnel, but we still have work to do. We need to ensure that these vaccines and supplies continue to be delivered quickly.
To ensure that Canada has the vaccines, logistics systems, and supplies in place to further combat COVID-19. And we will not rest until we climb this mountain. Merci beaucoup, Miigwech. Thank you so much.
Thank you, Minister. We'll now turn to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Dylan Robertson, Winnipeg Free Press. Line open.
Good morning, Prime Minister. Are you intending to divvy up the initial Pfizer doses on a per capita basis to provinces? And is there going to be a separate quota for First Nations on reserve for any other Indigenous group?
The NACI, the Immunization and Vaccination Advisory Board, filled with scientists and experts, have made determinations around the most vulnerable populations that need to receive vaccinations in a priority basis, and that is guiding our efforts and our decisions on rolling out vaccines. We recognize the challenges around logistics of the Pfizer vaccine. I've been working closely with Northern Premiers and Indigenous groups. We've identified 14 sites across the country where we will be able to immediately start delivering those Pfizer doses because they require 80 below temperatures. So it is not easy to roll them out to more remote locations, but this process will allow us to stand up our processes for delivering and handling this first vaccine as quickly as possible. there will be more doses of other vaccines at later dates on a priority basis for Indigenous peoples, particularly those who are northern and remote. Okay. Nous avons identifié 14.
Answer repeated in French. We have identified 14 distribution sites for vaccines for the Pfizer vaccine. This is in urban centers, but it will be distributed according to the Immunization and Vaccination Advisory Board in line with their recommendations. We will continue to work with vaccine developers and Indigenous communities and the premiers of northern communities in order to give them what they need as quickly as possible.
And Prime Minister, Manitoba has the highest proportion of Indigenous people, and Premier Brian Pallister said that if you give the vaccine to provinces on a proportionate basis, but then make them prioritize Indigenous people, that all other Manitobans would be waiting the longest out of all Canadians for a vaccine. To you, is that a racist comment?
Our work is to make sure that all Canadians get vaccines as quickly as possible, and with the contracts we've signed, with the news we're announcing today, we're well on our way to do that. In terms of distribution, I think all of us understand that getting vaccines first to the most vulnerable people is exactly what we need to do, and that's what we're focused on.
Next question, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Question from La Presse canadienne. Hello, Mr. Trudeau. In your opening remarks, you said that the delivery of vaccines will depend on approval. So I'm wondering if things have changed. Answer, we are working closely with Pfizer. This vaccine needs to be stored at -80 degrees. And so we want to deliver the vaccine to Canadians as quickly as possible as soon as they arrive. That is why we hope that Health Canada will approve the vaccine this week, and we will be able to deliver that vaccine next week. Regarding the approval process, I'll ask Howard to add if he has anything to say. Our colleagues at Health Canada are working hard. We have one of the best health systems in the world. This allows us to reassure Canadians that any vaccine that is approved here is safe and effective. That is why we are waiting on Health Canada's decision. Follow-up question? So, you can't say if the approval process has changed, but now regarding numbers, 150,000 doses, does this mean 150,000 people will be vaccinated in Canada by the end of the year? Answer, we are expecting 249,000 doses by the end of December here in Canada. And these vaccines have 2 doses. This means that we will start vaccinating the most vulnerable first.
Thank you. Merci. Next question, Steve Shear, Reuters. Line open.
Hello, Prime Minister. I wanted to go back and ask a little bit about what Dylan Robertson was asking about before. Can you confirm that First Nations isolated communities in the north will have priority access to vaccines, say, before than the general public in places like Ottawa?
We have worked very closely with the premiers in the Northern Territories, as well as Indigenous leaders across the country. We know that they are a priority population, and therefore will be part of those initial 3 million doses we're expecting in the beginning of 2021. Those are expected to be a combination of Pfizer and Moderna doses. The Pfizer vaccine, because it is required to be stored at 80 below, has more significant logistical challenges, which is why we are setting up initially 14 distribution centers in large urban areas, but they will be added with more over the coming weeks. Perhaps Major-General Fortin can speak to the logistical distribution, including as we get out to further areas.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Prime Minister.
The territories have indicated a preference to other vaccine candidates because of the complexity associated with distributing the Pfizer vaccine. So we're very much paying attention to the priorities and making those vaccines available as rapidly as possible once they're approved. In terms of distribution of the Pfizer vaccine, as mentioned earlier, the 14 sites are to be ready by next week. Preparations are well underway. Once we're comfortable with that process, we'll expand deliberately into other areas in close coordination with provinces and territories. Certainement. En français, je pourrais vous ajouter que...
Answer repeated in French. We are working closely with First Nations and the territories, and they have indicated their preference for a product that will be easier to handle. We are focusing on the distribution of vaccines, and we are working closely with territories and First Nations. Same thing with the provinces for the regions that are more difficult to reach. Regarding Pfizer now, we have our 14 distribution centers, and we are working to prepare these sites with the provinces, and we will be ready to distribute the vaccine as soon as it's received the approval. And we will be able to increase the number of centers with the approval of the provinces.
Yes, Prime Minister. Last week you had said that there would be further guidance as to what the priority groups would be, so the people who would first be getting the vaccine. And I guess my question is, will the provinces then be expected to follow those guidelines in the same way that essentially the federal government sets them? So do you expect the provinces to then follow the federal guidelines when they implement the vaccinations?
We've set out through the recommendations of the expert group on vaccine prioritizations, clear guidelines, and it'll be to the provinces to adjust and implement them in a way that is suitable for their populations.
Thank you.
De Radio-Canada.
Question from Radio-Canada. So just to make sure that I understand correctly, you said the first doses will be arriving next week, but when will Canadians first be vaccinated? What's the delay? What's the timeline between the distribution and vaccination? Answer. All of this will be happening quickly. Canadians will be getting vaccinated starting next week, pending Health Canada approval this week. Is there a time, Howard, between distribution and vaccination? Mr. Fortin answers. This should be very quick. Perhaps 1 or 2 days between defreezing the product and preparing it. It seems complex, but it should be fairly simple for healthcare professionals.
So far, I'm okay. Yes, I would simply say that it's a matter of a day or two, is my understanding, based on the fact that once you receive the product, you have to unpack, thaw, decant, mix. So that's a relatively fast process for the health professionals.
Dr. Njoo, you were just at the point that when you look at the actual vaccination of Canadians, it's a very close, obviously, integration between the public health aspects and the logistical aspects. So as Major General Fortin pointed out, you know, the delivery and the decanting and all the mixing and so on, all those technical details has to also then line up with what, from a public health perspective, is the practical aspects in terms of looking at the priority populations that need to be vaccinated, and depending on the number of doses and when they come, how that's actually going to be operationalized in terms of actually, as you say, getting the doses into people. The other point also that we're looking at from a public health perspective is that not all the doses are going to arrive all at one time. It's going to be sort of a regular stream. And so that's part of the planning process in terms of public health priority populations. What's also practical, what can we do in the early days, and maybe it might be a focus on urban centers or places where it's more, I think, amenable to having those vaccinations take place. And then as we get more and more doses, we'll be able to offer it to more and more Canadians. Thank you.
Minister Anand?
Thank you, Prime Minister. I just want to bring it back to our contract with Pfizer. There are a number of stages that need to be walked through before the deliveries occur. So, of course, I want to stress the importance of approval from our independent regulator at Health Canada. After that, there is the window, of course, for shipments to occur. But before those shipments occur, Pfizer needs to be assured that the provinces and territories are ready, in fact, to receive those doses. And it's important to know that that's the work that Major-General Dany Fortin is doing with the Public Health Agency of Canada in conjunction with the provinces and territories. Once we are assured of provincial and territorial readiness to receive, then we will be able to pass the baton to the provinces and territories. So the last kilometer, in fact, is with the provincial and territorial jurisdictions, and we will carry the baton as far as we can along that line. Thank you.
I'm McGregor, CTV News. Prime Minister, a few weeks ago, you came out and said that Canadians are going to have to be prepared to watch citizens in other countries get the vaccine first. Then, I think it was last week, you said it didn't matter when we get to the start line, what matters is when we get to the finish line. Now, today, you're kind of pulling a rabbit out of the hat and saying, hey, we're going to have vaccines in December. Did you instruct Minister Anand to go out and negotiate this deal to get a comparatively small number of vaccine doses because you were concerned about the political optics of seeing other countries getting vaccinated first?
We've been working on signing contracts that are flexible enough to get us the earliest possible doses of vaccines since this past summer. This was always an intention that we had to try and get vaccines to Canadians as quickly as possible, along with our imperative of securing the largest number of doses for Canadians possible from the largest range of potential vaccine producers. When we made a commitment to Canadians that we were going to do everything we could to give them the support and the path through this, we were serious about that. We know that there is a tremendous amount of uncertainty in terms of which vaccines were going to arrive first, which ones were going to be able to be manufactured quickly. These were always built into our process as possibilities. But until we were able to sit down here today and announce firm delivery pending the final approval by Health Canada, we wanted not to get people's hopes up because this is something that Canadians have been looking forward to for a long time, getting to these vaccines and getting beyond that. I will say from a logistical and delivery standpoint, this is the largest mobilization of vaccines in Canada's history, and being able to start with a smaller number and rapidly scale up as the flow of vaccine doses starts increasing quite rapidly. This is a good thing to allow the folks on the ground to be able to deliver certainly this Pfizer vaccine, which has a high degree of complexity in the delivery.
Answer repeated in French. Since the summer, Minister Anand and others have been negotiating with vaccine companies in order to have as many doses as quickly as possible for Canadians. We have already mentioned that we have secured more doses per person than any other country in the world. We have also mentioned that we have a better array of vaccines from different companies. That way, those that are the most effective will arrive quickly in Canada. We also worked with these vaccine companies to ensure that Canada will be receiving them as quickly as possible. I know that this is something that Canadians were expecting, and that is why I'm so pleased to be able to announce this today, because we can now say with certainty that this will start next week. It is going to be fairly complex, so that is why it is good to start with fewer doses, and then we will be ready to vaccinate as many people as possible very quickly, perhaps tens of thousands, hundreds of thousands of people every week.
You say we're getting 249,000 doses by the end of the month. Can you spell out in as much detail as possible who are going to get those doses?
The contract we've recently amended with Pfizer allows for them, they engage to deliver up to 249,000 doses to Canada before the end of December. In terms of distribution, next week's distribution will happen through 14 different sites that have been identified across the country, one in each province and 2 in our 4 largest provinces. This is to be able to initially get doses out to the most vulnerable people, but also to demonstrate and to operationalize what is going to be an incredibly complex mobilization of vaccines across the country. It is a gradual process that is going to begin this coming week, next week. But let us remember, at the beginning, there will be smaller amounts of vaccines because we are both standing up our delivery mechanisms, but also because manufacturers are limited in what they are able to produce for this vaccine. The large mass manufacturings will be happening into 2021, but with these 249,000 doses coming in December, we will be able to begin on the most vulnerable populations and make sure that we have the logistical grounding and foundation in place to be able to deliver right across the country over the first months of 2021. Any further additions to that? Anita?
I would just add to those very accurate remarks that we are utilizing our negotiating position, a very strong position with vaccine suppliers. Each and every day, we are in touch with these suppliers in order to ensure that Canadians are in the best possible stead. So in those negotiations, we are continuing to press for the earliest possible delivery dates once Health Canada approval has been obtained. And that is why we were able to secure the agreement with Pfizer announced today. And that is why we will continue to work with our suppliers for the earliest possible delivery dates for Canadians. Thank you.
I would like to just clarify your answers previously to my other colleagues before I ask. Is it per capita then for this first 250,000 doses, or is it based on a province's share of it, the most vulnerable people you want to target, or is it based on the province's readiness to receive vaccines? And if it's based on readiness to receive vaccines, can you talk a bit about what are the conditions that you need to see in those provinces? Because if things go wrong, who's then liable? Have you allowed the companies to waive liability, for example? Are you wearing the liability? Could you speak a bit about that, please?
The decision on distribution to provinces and territories, it was agreed, is going to be done on a per capita basis. For the further complexities, I will turn to the doctor and the Major General. Dr. Njoo.
Okay, maybe I'll start. So yes, we've been having active discussions, you know, with our public health counterparts in the provinces and territories for quite some time, and they're ongoing. So as I mentioned earlier, we have received the advice from the National Advisory Committee on Immunization, and so everyone's aware of the 4 priority groups, you know, Indigenous communities, healthcare workers, older Canadians greater than 80 years of age starting off, and then moving down to younger Canadians. and then, of course, individuals in long-term care facilities. But as we receive the vaccines, the other consideration we're discussing, and Major General Fortin can speak to it, are the logistical aspects as well as the epidemiology in each of the provinces and territories. Every province and territory might have a slightly different experience, and so how they receive the vaccines and prioritize and actually deliver those initial doses to their populations, I think certainly will be based on their own experience and what they determine is best for their individual context. I think I'll leave it at that and pass it on to Major General Fortin.
The liability. The liability. If things go wrong, do you wear it for
Liability.
I'll turn to Mr. Anand for that.
You can call me doctor. Listen, I think we have to be very clear that every Canadian who wants access to a vaccine is going to have access to a vaccine, and that vaccine is actually provided free of charge from the federal government. In terms of liability issues, it's really important to remember that in our contracts, we specifically implemented clauses that ensured that the vaccines would not be distributed unless they were approved by our gold standard regulator at Health Canada. And that has been the very important point that I continue to mention, perhaps ad nauseum, because it is the way in which we as a country here proceed based on science, based on the best advice of the scientists before we have this rollout. And so in terms of liability, we are able to hedge, therefore, that liability by relying on the excellent judgment of the scientists at Health Canada.
Merci, Monsieur le Premier Ministre. In terms of logistics, we're in daily coordination with provinces and territories. And with the 14 initial sites, we're closely monitoring their level of readiness. We have agreed on the condition criteria with the provinces. The provinces are really on track to have all those sites ready. We're exercising a dry run this week. Boxes are in the air right now. They left Belgium and they're on their way to the next transit node in the cold chain. They're being monitored. So we will learn. This is one way this week where we will learn how the process will flow if adjustments need to be made. Pfizer will learn just as much as we will because they will make some necessary adjustments. Next week, as indicated earlier, 14 sites ready. We're confident at all levels that we're going to get there with some adjustments as we go over the course of the week and next week, no doubt. But we're confident that we're in a good position to start. We have a good visibility on those conditions, and the training is underway starting tomorrow. And then from there, we'll expand in terms of numbers and expand at scale.
On the question of liability, I think the most important thing to remember is these vaccines don't get approved unless they are safe for Canadians. Health Canada has one of the most rigorous approval processes in the world, and we are deeply watching other countries go through their processes, but we will make our internal, Health Canada will make its own internal process decisions based on what is safe for Canadians. And if Health Canada approves these vaccines, then we will begin to deliver these safe vaccines to Canadians across the country. In regards to the contract signed, there was questions of liability, and Canada has undertaken the necessary measures to ensure that everyone is protected through that. Oui.
Answer repeated in French. The decision was made by the expert panel and by the government that the distribution of vaccines will be done on a per capita basis throughout the country for all provinces. The provinces will work regarding the framework on the most vulnerable or on priority groups. But we also need to remember that we are at the beginning of a distribution process, and millions of vaccines will be distributed to Canadians in the coming months. we will be learning how to manage this vaccination process, and it will allow us to vaccinate millions of people per month and perhaps even on a weekly basis. This is good news that we're starting now, but the great news is that this is a beginning that will allow us to move gradually, and we will be able to vaccinate the most number of Canadians safely in the coming months.
Can you just clarify, out of the 249,000, will that be 249,000 people who receive the vaccine, or will that be about half that amount of people who get the shot but they'll get 2 doses? And my question is, I understand the government has a diverse portfolio when it comes to vaccines. There has been more option for Moderna, knowing that it might be easier to transport around the country, especially to remote communities or northern communities. Moderna's never created a vaccine before. It's never scaled up to this size before. How much confidence do you have in Moderna to do that?
First of all, we will continue to work with all vaccine manufacturers on their delivering of supplies. Yes, there is significant unknowns in terms of manufacturing capacity for various vaccines. They have never been made at this scale before, at this speed before. That's why, first of all, the regulatory process needs to be as rigorous as it always is. There are no corners cut by Health Canada in terms of approving a vaccine for safe use by Canadians. On top of that, we know that in building a new vaccine, there would be challenges that certain companies would encounter that others might find an easier time with, which was why we set out to build the most diverse portfolio of vaccines in the world, and we ensured more than enough doses for Canadians through all those different vaccine contracts to make sure that if one company does face greater logistical or manufacturing or health approval challenges than others, we have others that will ensure, other contracts that will ensure that Canadians stand the best chance possible of getting vaccinated and getting through this COVID-19 pandemic as quickly as possible. The Pfizer vaccine is a 2-dose vaccine with a few weeks apart. Part of the challenge of the logistical delivery is to see whether those doses can be properly stored and delivered a few weeks later to the same people. That's what Pfizer as a company is looking for. You can imagine that any responsible company like Pfizer is going to want to make sure that none of their vaccines are going to be wasted through inability to properly store, transport, or administer. Every single dose of those vaccines are extraordinarily precious right now. So they will be looking very, very closely at our ability to do that. So those 249,000 doses to be delivered in December, the vast majority of them, if not all of them, will be 2 doses for a single individual.
Thank you, and that concludes today's press conference.
Merci beaucoup tout le monde.
Thank you. Merci. The conference is now